Okay, good evening, everyone, and thank you for joining us this evening for our second in a series of our family education series. I'm really excited to be here with you this evening with some really dynamic presenters that are going to share the next hour and a bit with you. My name is Joanne Jones, and I'm the Director of Nursing here at Kinark Child and Family Services, and I will be the moderator with you this evening. Our family education series are intended to build your ability as caregivers and family members to identify, understand, and respond to childhood and adolescent mental health distress or disorders for those people that are living within your lives. In particular, today's session, we will be discussing disruptive behaviors in children and share effective intervention strategies for caregivers to develop your toolkits. I'd first like to talk to you about a few housekeeping items before we get started this evening. I think we can go to the next slide. Thank you. So all participants, if I can ask you to mute your phone lines and turn your cameras off to ensure clear connection throughout the session. We do have quite a few people joining us this evening. So to mitigate the risk of any technological issues that we might find, muting your phone and turning off your camera certainly helps us with that. We've set aside some time at the end of our session to have any questions that you might have answered. You can ask the questions by selecting the Q&A icon that you will see across the top banner of your Teams bar, and you will click on this to submit any questions. There is an anonymous feature if you would like to ask a question anonymously. Please note that unfortunately, we might not be able to respond to all of your questions this evening, and we might sometimes cluster questions that are related to each other. We will try to respond to as many questions as we can and to ensure that there's time to respond to as many questions as possible. At the end of the evening, your response to the evening is very important to us, and we will be launching a poll to collect your feedback on our session this evening. Please take a few moments to respond to the poll so we can have your feedback and look for areas of improvement as we move forward. If you are having any technical difficulties this evening, please use the Q&A feature to report them, and we will try our very best to help resolve them in real time. I would now like to welcome our very dynamic presenters for this evening. We have Joey Brereton, our Clinical Services Supervisor at Kinark, and Marlena Colasanto, our Psychology Resident at Kinark. Jody comes to us from our clinical services area in Simcoe, and she provides clinical supervision to our clinical therapists, ensuring that she supports the best quality clinical work for our clients. Marlena comes to us as a psychology doctoral resident in her final year of her clinical training. She has been providing psychological assessments and evidence-based interventions in our York area program. I'm now going to hand it over to our presenters to start with the presentation. Thank you both.
Thank you, Joanne.
Thank you. Okay. So we'll first talk about disruptive behaviors and some diagnoses that are commonly associated with disruptive behaviors. We'll also talk about how disruptive behaviors develop or how we understand them to develop, as well as the function of behaviors, of disruptive behaviors specifically. Then we'll get into parenting styles and effective intervention strategies. And then we'll wrap up with discussing where to get help in terms of psychotherapy and provide some additional resources. Okay. So according to the American Psychological Association, their definition of a disruptive behavior is a behavior that chronically threatens and intimidates others or violates social norms. However, we also now understand disruptive behaviors as a behavior when a child or adolescent has difficulty controlling their actions and difficulty controlling their emotions or how they feel in a particular situation. And these behaviors are typically considered uncooperative or defiant. And depending, of course, on the severity or how persistent the behaviors are, it can also have quite a significant impact on a child or adolescent's functioning within the home, school, academic setting, or social settings. When it comes specifically to diagnoses, disruptive behaviors, broadly speaking, are typically part of the clinical presentation that we see in some way, shape, or form of attention deficit hyperactivity disorder, disruptive mood dysregulation disorder, oppositional defiant disorder, and conduct disorder. However, just because your child or youth may exhibit disruptive behaviors, this does not necessarily mean that they have a diagnosis. So we're going to spend the next few minutes now going through some of these common diagnoses where we see disruptive behaviors present. So the first one is attention deficit hyperactivity disorder, or ADHD. And ADHD is a neurodevelopmental disorder that affects approximately 5 to 9% of children and adolescents. And the clinical profile of children and youth with ADHD is this persistent pattern of difficulties with inattention and or hyperactivity and impulsivity that interferes with their functioning. So overall, there are 3 types of ADHD diagnoses that we make, and these are predominantly inattentive presentation, predominantly hyperactive impulsive presentation, or combined presentation. So where we're seeing both inattentive symptoms and hyperactivity impulsivity symptoms. And this combined presentation is the most common presentation that we see. As part of the diagnostic criteria, the ADHD symptoms present must be evident prior to the age of 12 and must also be present or 2 or more settings. So we have to see these symptoms and traits present in more than one setting, in at least 2 settings. So for example, at home, at school, in sports, in extracurricular activities. And some of the common symptoms or traits that we often see associated with an ADHD diagnosis include the following, but are definitely not limited to just this list. So when children or youth fail to give attention to detail or make careless errors, for example, when they have difficulty sustaining attention for long periods or long chunks of time, they may have difficulty organizing tasks or activities. They may be forgetful in their daily activities and things that need to get done. They may also have difficulty playing or engaging in leisure activities quietly. We often say that sometimes these children and youth act as if they're driven by a motor or feel or look like they're constantly on the go and have difficulty sitting still, and blurting out answers before a question has been completed. So the sort of hallmark criteria for ADHD, in addition to these symptoms, that we have to see this persistent pattern across multiple settings that's significantly interfering with functioning. Disruptive mood dysregulation disorder is a relatively newly classified disorder in the diagnostic and statistical manual that we use to make these diagnoses. And this disorder is characterized by intense and recurrent temper outbursts that can manifest either verbally, such as verbal rages, or behaviorally, such as physical aggression. And these temper tantrums or outbursts go beyond what we would consider developmentally appropriate. So we know all children become irritable. It's normal to react. It's a normal reaction to frustration. However, those individuals with DMDD experience severe irritability and have difficulty tolerating frustrations and have outbursts that are grossly out of proportion in intensity or duration given the current situation. And these outbursts occur more often and are more severe than what you would typically expect for children of this age. As part of the diagnostic criteria, these temper outbursts occur 3 or more times per week and must also occur again in at least 2 settings. And the outbursts and tantrums have to have been ongoing for at least 12 months. And a child or youth who's diagnosed with DMDD, their mood in between these outbursts, and what we see clinically, is we see this persistently irritable mood or angry mood most of the day, nearly every day, and is observable or noticeable by others around them, such as parents, coaches, peers, teachers, etc. And a diagnosis of DMDD cannot first be made prior to the age of 6 or after the age of 18. And clinically, we see that the prevalence rate of DMDD is between 0.8 and 3.3%. Oppositional defiant disorder is characterized by a pattern of anger and irritability type symptoms, argumentative behavior, and vindictiveness. So largely speaking, the clinical presentation of children and youth with ODD can be broken down into these 3 categories here. And some symptoms may include things like often losing their temper, are easily annoyed, argue with adults, or actively refuses to comply with requests, blaming others for their mistakes, and seeking revenge, just to give a few examples. Again, many of these symptoms also occur in children and youth without oppositional defiant disorder. We know that children and teens disobey, they argue with parents, they defy authority, and that's completely typical and what we would see in normal development. But in those with ODD, these symptoms tend to occur more often and interfere with things like learning, with things like school adjustment, social relationships, functioning within the home environment, and can disrupt relationships with others. And it's important to note that as part of the diagnostic criteria for ODD, these symptoms, again, must be present for at least 6 months and demonstrated during an interaction with at least one individual who is not a sibling. And the prevalence rate for ODD ranges from 1% to 11%. Finally, conduct disorder refers to a group of repetitive and, again, persistent behavioral and emotional difficulties in children and adolescents. And children and adolescents with this diagnosis have great difficulty following rules, respecting the rights of others, and behaving in what would be deemed a socially acceptable way. Children and adolescents with conduct disorder may present with some of the following symptoms listed here on the screen, but again, not limited to just this list, but often will bully, threaten, or intimidate others, initiate physical fights, displays being physically cruel to people and animals, may deliberately destroy other people's property, steals items from others, such as shoplifting, and runs away from home or leaves home for a lengthy period of time. And again, as part of the diagnostic criteria, we need to see significant impairment in various settings, such as social, academic, or occupational functioning. And the prevalence rate for conduct disorder ranges from 6% to 16%. Okay, so how do disruptive behaviors develop? The development of disruptive behaviors is multifactorial and determined by complex interactions among a variety of factors. Every child we know is born with a unique and distinctive temperament, and research has actually shown that certain qualities of a child, such as distractibility, risk-taking behaviors, and how a child may respond to new situations or change, exist at birth and can influence the way a child may respond and adapt to their world or their environment. Some children we know are born with a predisposition to emotion dysregulation. So for parents and caregivers in the audience this evening, your parenting strategies, for example, may work effectively with one child, yet may be ineffective or not as effective with another child. And we know that as an example, one child may react immediately and intensely to emotional situations and have a hard time coming down, or what we say have a hard time sort of returning to their baseline. And children and youth who have difficulty regulating their emotions, we know are unable to adjust their behavioral responses to the intense emotions that they may be experienced as distressing or overwhelming. Another way that we understand the development of disruptive behaviors is through what we call lagging skills. And one thing that's critical to remember is that behaviorally challenging children and youth are challenging because they lack the skills to not be challenging. So they lack skills such as flexibility, or they lack the skills, or maybe the skills aren't as developed, or we would say are underdeveloped. And these are skills such as flexibility, adaptability, frustration tolerance, and problem-solving skills. And complying with requests from adults and teachers, things like handling disagreements, completing a difficult homework assignment, dealing with a change in plans, all requires these types of skills. And for these children and youth who have these underdeveloped lagging skills, these challenging behaviors occur when the demands of a situation being placed on them outweighs the skills that they have to respond in an adaptive and helpful way. And we know that when children and teens do have the skills to respond adaptively to demands and expectations of their environment, then they do. With respect to social environmental factors, so children and teens with disruptive and challenging behaviors, we know can be challenging to parent and overwhelm parents at times. And the interaction between parents and their children, although may not cause the disruptive behavior, can certainly maintain disruptive behaviors over time. For example, in an effort to maybe help diffuse a situation and make their child or teen feel better, parents can sometimes, we know, inadvertently minimize their child's feelings. And when parents say things with all the good intentions, but when parents say things like, don't worry, you'll feel better later, or it's not that big of a deal, although the parent is trying to be helpful, this might actually make a child believe that their feelings perhaps do not matter, or that they quote unquote shouldn't be feeling a certain way, which then causes the child to feel more distressed, particularly for those who have this predisposition for having difficulty regulating their emotions. Another way that parent-child interactions can maintain behaviors is through what we call, and what research calls, parent-child coercive cycles. And this cycle, as an example, typically begins by a child misbehaving, followed by the parent then reprimanding or disciplining the child, which may then result in the child's exacerbation of the misbehavior. And if the parent then disengages to stop the child's disruptive behavior, then both the parent and the youth are actually shaped by this response. So the parent, for example, has been shaped to perhaps give up when the child's behavior becomes disruptive or challenging, and the child has been shaped to become disruptive again the next time the parent disciplines. And this reinforcement of the child's misbehavior then creates this, what we call like a positive feedback cycle, whereby the parent-child interaction then becomes more difficult to manage, leading to the escalation of disruptive behaviors over time. The good news is, though, that this is where parents can really intervene to break this cycle and help manage these disruptive behaviors.
So we're going to get into a little bit about what to do later in the presentation, but one of the things in terms of parenting, what not to do is to overreact. So if a youth is presenting with a certain behavior, then the parent overreacts, and what that does tend to do is escalate the situation. Sometimes parents take things personal, and that's never a good idea just in terms of parenting, because we want to be able to support our children. And lots of times children and youth are are behaving in a way that's not meant to, upset parents in particular. And the last thing is is to escalate the situation itself. So really what we want to do is really stay calm as a parent, and we'll talk about some strategies later on in the presentation. So next slide, please, Marlena. So the functions of behavior, so there were some folks that wanted to talk a little bit about that, is that there's 4 areas that children and youth seek about the functions of behavior. And those 4 areas are attention, escaping, access to tangibles, and sensory stimulation. So attention-seeking behavior occurs when someone's desires feedback or response from another person. So that's kind of their goal as a child and youth, is that they want the attention of whether it's the parent or other people. And that's the kind of the goal of the behavior. So inappropriate behaviors might take the form of pinching a sibling or knocking something over or calling out something in class. So someone that's calling attention to themselves in a class setting, telling jokes or being inappropriate. So just to dissuade attention-seeking behavior, the key is really to ignore the behavior. So the problem behavior, if you're typically to ignore that, then it's not rewarded if the goal is really about seeking attention. The function of behavior for escaping it. So escape behaviors typically occur when a child wants to avoid something. So they want to escape from doing something. For example, if a child does not want to read a book or clean their room, they may run away from the person who is expecting this of the child. So token kind of systems can be effective in this type of situation, where it's treating the escape behavior. So rewarding the behavior that you want to see. So based on, like, if you were wanting them to read the book, then they might get some kind of reward for doing that. Access to tangibles is that children may engage in certain behaviors because they're looking to gain access to something. So for example, they might want a cookie, and the cookie is a strong reinforcement for the child. So he or she will engage in interfering behaviors such as begging, hitting, grabbing, or tantruming to get that cookie. Sensory stimulation is another function of behavior that occurs when children want to experience a pleasant sensation or replace discomfort. Children may seek stimulation to sensitize or desensitize depending on their sensory needs. So these sensory stimulations can manifest themselves such as jumping, skipping, tapping their feet, or rocking back and forth. This is another what's called the ABCs of behavior. So the antecedents, the behavior, and the consequences of behavior. So when addressing difficult behaviors, first we want to look what's happening before the behavior takes place. So these common causes typically are in the areas of potentially organic causes. For instance, there might be some medical factors such as a brain injury or an impairment, like physically. Perhaps there's a communication or cognitive ability that's getting in the way of their behavior. The other thing that happens before behavior is their emotional state. So individuals might be feeling a certain way, so happy, sad, anxious, or the other behavior is about thoughts and cognitions. So the way that the youth sees themselves and others might be getting in the way before the specific behavior happens. The environment is also an antecedent before behavior happens. What surrounds us, including the noise, the temperature, activities or space. So for certain individuals, the environment is a huge factor that might, loud noises or bright lights might be a sensory overload for some individuals and might cause behaviors to happen. social relationships and how we interact with others in our environment is also an antecedent before behavior happens. So what is the behavior? So we talked a little bit about those types of behaviors, whether it's escaping, aggression, or avoidance. Behavior is defined by the way in which people act towards others and common behaviors that people seek support. So the aggression piece might be kicking, punching, screaming, and avoiding, withdrawing, or picky eating. And the escaping is potentially running away. So in terms of consequences after the behavior happened, consequences are what happens once the behavior has occurred, and a consequence can either increase or reduce the likelihood of the behavior happening again. So for instance, the child might see a chocolate on the table and the behavior is to scream and punch, and the parent gives the child the chocolate to end the behavior. So next time the child is more likely to scream and punch to get the chocolate, because that's kind of a learned behavior that the parent has encouraged based on the history there. So to reduce the likelihood of disruptive behavior, if a child is becoming bored in class and the behavior is speaking out and making inappropriate jokes, the consequence could be that students in the class were asked to not acknowledge these outbursts. So next time the child's less likely to speak out during the class because he's not receiving the attention that he wanted. So that's the planned ignoring there. Next slide, Marlena, please. So this is the area of what parents can do. So parents can remain calm and stay neutral. We're going to talk a little bit more, Marlene is going to talk a little bit more later about validation, but we really want to emphasize that what you can do as a parent, and it's very important, is to empathize and validate your child. So if you see them getting upset, you can say, I can see that you're angry and this must be really frustrating. Sometimes children and youth don't necessarily have the language or the verbal skills to express what they're feeling. So that also helps to be able to give them the words to be able to express what's going on for them and validates what they're experiencing. Parents can spend one-on-one time, like 5 to 15 minutes a day. It doesn't have to be, a trip to Wonderland or anything, but it can just be small portions in the day and regularly consistent throughout the week. So those small little portions can make quite a difference for, checking in on your children before they go off to school or at the end of the day, before bedtime. It doesn't have to be long periods of time. Parents can create routine and structure. What we know over COVID is that that's been really important for mental health and wellness, to create physical activities for children, healthy eating, and a good sleep routine. The other thing that parents can do is really help children feel a part of the family by having them contribute to the family. So encouraging children and teens to have some responsibilities at home, and if this builds autonomy, independence, and their sense of belonging. So here's a few tips from this infographics that parents can do to build strong relationships, and try to think of starting each day fresh. So I know that when I speak to lots of parents, sometimes the consequences kind of go on and on and on and on. If parents can kind of think about each day as a fresh day, starting fresh, if there was behaviors yesterday, then starting fresh with a new day, staying calm in times of stress, developing routines and teaching them, like laying out their clothes at the night before, or helping to meal plan or purchase, help to make their lunch in the evening before. Identifying triggers ahead of time. So if there's certain things that, children and youth are, particularly sensitive about, whether those are sensory things, identifying that, maybe bright lights or certain clothing are upsetting to young people, that, to be sensitive to those types of things as well. Keeping all adults on the same page so that parents in particular are on the same page. We'll talk a little bit later about different parenting styles. Avoiding power struggles with children and youth, and knowing that that there's certain things that, whether it's the way the child and youth wants to keep their hair, or they might not have completed the last homework question. So you might want to pick your battles just in terms of what's going to be a power struggle in the household. Children respond well to being provided special responsibilities. So whether it's, developmentally to make their bed, or set the table, or put the dishes, feed the dog, those types of things. So it's important to stay consistent in parenting, and that letting the little things go. Important to use their interests and ask them what they want to do in terms of sports that they like to do, or clubs that they want to join. Sometimes parents are, signing kids up thinking that, they really want their child to be the best hockey star in the world, but it's always helpful if the child has input in terms of what kind of activities they're involved in. So teaching social skills and coping strategies, and those can be modeled. What you want to see in your child, you want to model for your child. Alfred Adler coined the phrase social interest. In particular, after COVID, this has become relevant, and what we want to teach our children is the awareness of belonging to a community, that children and youth have a responsibility to contribute and shape society. The more one gives back to the community at large, the greater their overall mental health is. And we have a poll on this question as well. Are there specific parenting strategies that you have found helpful that you would like to share?
Sorry,
Hi,
we don't
Jody.
have that there.
So our polls are now set up for the end of the session, the satisfaction ones. That's okay.
Oh, okay. All right.
Okay.
So moving on.
Okay. Thank you. Okay, we're going to spend some time talking about validation. I think we could likely talk about validation for the entire hour, but we won't. But another thing that, as Jody was alluding to, that parents can do is to validate. We know when emotions are high, it can be extremely hard to problem solve in those moments, to think logically. It can be hard to calm down, to see others' perspectives or the situation from the other person's perspective, or from your child or teen's perspectives, and can also lead to others' emotions running high. And when our emotions are running high for a child, it can be really easy for us and parents to escalate, and it gives us a greater chance of being ineffective. So it's important for us to be mindful of ourselves, of our communication, and how we're communicating to our children in these moments. So validation communicates to your child or adolescent that their feelings, thoughts, and actions make sense and are understandable to you in a particular situation. Validation does not mean that you necessarily agree with what the other person or with what your child is doing, saying, or feeling, but it just means that you understand where they're coming from. There's some kernel of truth that you are able to understand why or how they might be feeling or thinking or behaving in a certain way. And it's important to validate because we know that validation actually improves relationships. It de-escalates conflict between parents and children, and it reduces those intense emotions. And it shows to your children and teens that you're listening, that you understand, and that you're being non-judgmental in that situation. So how do you validate? This is just a sort of short, quick list on how to validate. But one thing is through our nonverbal cues. So things like maintaining eye contact, listening actively, staying focused, nodding your head, being attentive and present in the moment shows or illustrates to your child or teen that you understand. And then we have things that you can say to validate. So saying things like, it seems like you're upset, or it seems like you're feeling angry right now. It's okay to feel upset about this. Or it makes sense that you feel angry or upset because, and then insert the reason why they might be feeling that way. And the reason why I bolded because there is, it's often very natural for us to say, it makes sense that you feel angry, and then say the word but. So it makes sense you feel angry, but can you get your shoes on? We're already half an hour late. And when we say the word but, everything that comes before that word can really feel dismissive. It's kind of erased everything else that you've already said. However, when we replace that word with because, saying the word because already is expressing something about us understanding the child's experience or how they might be feeling. So just keeping that in mind to, if you catch yourself saying the word but, try to replace it with because. Or saying things like, I understand you're having a tough time right now. And we always say, even if you don't know what the emotion is, or you might not know what the emotion is in that moment, if that's what you're validating, just guess. Because teens and children especially will never pass an opportunity to correct their parents or caregivers if they got something wrong. So even if you don't know the emotion, it's always okay just to take a guess, and then they can always correct you.
So parenting styles, from this infographics, there's 4 that are outlined here. Attachment, authoritarian, authoritative, and permissive. So oftentimes when parents are co-parenting, whether they're living in the same house or not living in the same house, I often hear that they're have different parenting styles. So, and that's okay. Often permissive or let's say more flexible parents tend to be with more rigid parents. So there's this can often create conflict in terms of parenting together. And then the main goal really in terms of co-parenting is that you want to be on the same page. So you might have different parenting styles, but you have to find some kind of middle ground, because what happens when children misbehave is that they often know that parents aren't the same. So they might check in with one parent and then check in with the other if they can get the answer that they're looking for. So Barbara Coloroso's book, she has a book called Kids Are Worth It. It's a little bit of an older book, but it's quite relevant here just in terms of different parenting styles. So she describes 3 different types of parenting styles, the brick wall, the jellyfish, and the backbone parenting style. So the brick wall is very rigid, inflexible, and kind of heavy on the rules, whereas the jellyfish parent is really not have a lot of rules and not a lot of routine or structure. So what we really want to do, you know, and certainly as parents, we're probably kind of moving back and forth among them, but what we really want to aim for is being more of the flexible parent, which is what's called the backbone parent. So it's got structure, but flexibility. So you're creating that structure for the routines, and you're creating a safe, secure, and predictable environment for your child. And it's important to provide validation, as Marlena explained, with a positive reinforcement, with rewards, and keeping in mind always developmentally how old your child makes a difference just in terms of how you're going to parent. You'll parent, you know, like a toddler versus a tween versus an older teen very differently. And, you know, I guess the thing is, for parents, it's always a learning curve, is that, you know, be patient with yourself, that sometimes we don't always have the answers, and it's okay to seek help about that. And that it's constantly changing as your child grows and develops. So natural consequences versus logical consequences. If you're removing types of privileges, you want to make it related to what's happening and proportionate to the behavior. So for instance, if a child is, you know, constantly late in the morning for school, then a consequence might be that, you know, there's no kind of electronics in the morning, or it might be an earlier bedtime at night so that they're able to get to school on time. Next slide, Marlena, please. So folks might have heard a little bit about Triple P. So Triple P is a positive parenting program that's offered in the community. And at the end of this presentation, we'll give out some websites where you can access some supports for parenting. So this just outlines the Triple P guidelines. So it's setting clear ground rules, using directed discussion. So we talked about planned ignoring for kind of minor problems. Try and give clear, calm instructions and back them up with logical consequences. So for instance, if two children are fighting over one specific toy, then a logical consequence would be to remove that item. Triple P talks about using quiet time for misbehavior. So quiet time is like a short, effective way for children to learn acceptable behavior, which involves them sitting quietly at the edge of an activity for a short period of time. And then if that's not effective, the next step from quiet time is to use timeout for serious kind of behaviors such as tantruming, fighting, or hurting others. And this specific types of parenting strategies is meant for 2 to 10-year-olds. The other thing, just in terms of another evidence-based program, is what's called the Incredible Years. And really, there's like a pyramid of a parenting pyramid that they talk about. And the main base of the pyramid really talks about play and promoting the parent-child relationships. And you're always wanting to provide praise and building incentives to build social competence. When we're setting limits, you want them to be effective, and this increases cooperation among children. We talked about ignoring the distractive behavior, and this helps decrease aggression. So, and then as far as timeout, you really want to use that selectively, but use liberally the play part and promoting positive parent-child relationships. Next slide, please, Marlena. So this is just an outline of what children and youth want or need. So what I want you to do is that I'm not afraid of you, stop threatening me, praise me for the small steps that I take, and encourage. You want to use lots of encouragement, being fair and consistent. You want to include your children in activities. You want to be able to help them when they lose control. So, you know, when kids are out of control, it's really that they're needing some help to be able to move through that. Recognize that there are also positive motives behind troublesome behavior, and they want to be taught kind of how to self-control those techniques. And really spending time with them, insisting on that even when they want you to go away. So an Adlerian model of parenting emphasizes the child's psychological and behavioral goals, logical, natural consequences, mutual respect, and encouragement techniques. Next slide, Marlena.
Okay. So one type of evidence-based psychotherapy that's used to treat and manage disruptive behaviors is what's called cognitive behavioral therapy, or CBT. And CBT is used to help children and adolescents learn how to cope with their thoughts, their behaviors, and their feelings, specifically of frustration or anger that they may be experiencing. And at the foundation of CBT, it's really rooted in the fact that our thoughts, our behaviors, and our feelings are all connected, and all connected in a bidirectional way. So CBT specifically for disruptive behaviors may include identifying and labeling the emotion, understanding the function of their behavior and the function of their emotional experience, exposing a child or teen to situations on purpose that make them feel frustrated or make them feel irritable, so that they can learn to respond to those situations in a more adaptive way. And through this, children and youth often learn how to tolerate their feelings of frustration without having an outburst. Through the identification and teaching of skills to go along with that. And this therapy also teaches coping skills for controlling anger and ways to identify, challenge, and relabel their potential distorted perceptions or thoughts that might be contributing to their outbursts or to their disruptive behaviors. So these are just some examples of some cognitive distortions, or what we might call thinking traps when working with younger children, that individuals with disruptive behaviors may experience. And when we teach this, cognitive distortions or thinking traps, we do recognize that these cognitive distortions are automatic thoughts. And we work with children and youth to help recognize, identify, and reframe or challenge their thinking trap or their cognitive distortion. So for example, we have negative Nina, who is always focusing on the negative and ignoring the positive. Disaster Daryl, who is deciding that the very worst thing is going to happen without thinking of other potential less negative ways the situation could turn out. Psychic Suki, believing that they know what others are thinking without figuring out other more likely possibilities. And Jumping Jack, who is thinking that the chances of something bad happening are much greater than they actually are. Okay. So in terms of getting help for mental health difficulties, so there's many different avenues that families can take to seek support and help for their child or youth's mental health challenges or disruptive behaviors. The first point of contact is typically a family physician, and that's usually a good place to start, as your family doctor may be able to assess mental health themselves and potentially begin treatment if that's deemed necessary or needed at that time, or they may refer you and your family to more specialized mental health services. A community mental health organization such as Kinark can also be helpful in providing appropriate supports and resources, offering programs such as parenting groups, emotional regulation group therapy, as well as individual assessment and intervention services. Schools are also another potential resource that can provide some support, specifically a school counselor or a social worker, a nurse, and even a teacher may be able to provide more practical support, specifically as it relates to your child's functioning within the classroom environment. And finally, a mental health professional such as a psychologist, psychiatrist, or social worker can also provide support in terms of assessments and evidence-based interventions, while a psychiatrist specifically could also support and prescribe medication to help manage behaviors if they believe that that was the best course of treatment.
So here's some of the list of the group programs that are available. So we talked a little bit about the Triple P, which is the Positive Parenting Program. And we don't necessarily have that listed here, but if you were to Google Triple P, there are local community programs in your area that likely provide that. SNAP, which stands for Stop Now and Plan, is a group program, and Kinark offers that program. So that's specifically for kind of boys that are externalizing behaviors. They might have police involvement, that type of thing. So that's a program that's offered through Kinark. And then in terms of, oh, you were going to speak to the books.
Yeah. So in terms of books, we just put a few up there on the slide. So these are often books that we recommend to parents. So we have The Explosive Child and Treating Explosive Kids. And that Treating Explosive Kids also includes the Collaborative Problem Solving Approach, and that's by Ross Green. And then another book that we often recommend is Parenting a Child Who Has Intense Emotions. And this book specifically focuses on some of that emotion dysregulation challenges we were speaking to at the beginning of the presentation.
And then in terms of parent support group, we've got through Children's Mental Health, there is a parent support group. There's other parenting programs through what's called Strongest Families program, and the Hospital for Sick Children also has a Family First Parenting Workshop. And then Marlena, you want to speak to the ADHD resources?
Yeah, so these are two common resources that, again, we often recommend to families. This is specifically for children and youth and parents of children and youth who have or are diagnosed with ADHD. So they provide lots of great resources in terms of understanding the diagnoses, next steps, and supports. So these are the Canadian ADHD Resource Alliance and the Centre for ADHD Awareness Canada are both excellent resources. And you can, if you just put those into Google, their websites will pop up. Okay. This is just a course that we wanted to highlight, and this is a free online course that's actually offered through Yale University, and it's by Dr. Alan Kasdan, who's a professor of psychology and child psychiatry at Yale University, and he's the founder of the Everyday Parenting Toolkit program, and this is an evidence-based program for parents who want simple, effective responses to the everyday challenging behaviors of their children and challenges that come along with parenting. So we can leave that up for a few seconds if people want to jot that down. But it's just a free online course that's available to you.
Or you could take a screenshot.
Oh yeah, that's a good idea.
Okay, so this kind of is just an overall view of some of the other supports and resources that folks can tap into. So some of the resources that we have here at Kinark is that we would work with parents and children together. We might do some training with some parents. So kids can access, children and youth can access individual therapy. They might be able to do a social skills group in the community. Sometimes schools run social skills group or through their social skills classroom. There's opportunities for in-home behavior support, and those are also in the community. We have that at Kinark, and other community programs also have a variety of in-home programs. There's school behavior plans that, some youth have IEPs, that type of thing in schools to help manage behaviors and provide supports, or school counselors. And we touched on medication as well as an option.